Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts either through their industry insights, information, or simply learning from them. And today we have Cameron Sabet, a healthcare venture capitalist and medical researcher. Welcome to the show, Cameron.
Hello, and thank you for having me.
You are welcome. Welcome to the show. Welcome to India in this online form, Cameron. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to discuss right now. We'll be talking about transforming healthcare, from every angle. We'll talk about that. But before that, let me understand a bit more from you about your journey, about your background, Cameron, so that the audience learns better about who they are listening to.
Absolutely, certainly. Well, thank you again for having me on the show. My name is Cameron Sabet. I am a Georgetown University medical researcher based here out of Washington, D.C., in the USA. And I am a Lancet Global Burden of Disease senior collaborator, which means I collaborate with the Institute for Health Metrics and Evaluation in Seattle, Washington, for a series of Bill Gates funded global health studies called the Global Burden of Disease Study. And it's this big project by this guy, Christopher Murray. He's this professor. And we work on some of the largest epidemiological questions facing Americans and people all over the world. So recently, actually just yesterday, we dropped two Lancet studies on just all diseases and injuries across the US. One was for the past 30 years and one was forecasting until 2050. And these are informing lots of policies going on all over the world. And so, as an example, this is ending up in the New York Times, Time Magazine, a lot of different outlets. There are medical professors writing editorials about our work. There are policy papers coming out. And so there's a lot of work on the policy side, but then we can translate that into real world changes through venture capital. And this is kind of the marriage of venture capital and global health and global policy. So there's a lot of exciting work being done.
Absolutely, a lot of exciting work being done. So, Cameron, you talk about transforming healthcare from every angle. So, help us understand that part. What angle and how would you explain your role? You are doing so many things, and I'm sure it is you are impacting in many ways. But from a common person's perspective, listening to you from anywhere in the world, in any small village or from anywhere, how would you like to tell them what exactly you are doing, impacting, that they will understand from their point of view in terms of healthcare? People understand healthcare very well.
Mhm. Yeah, certainly. So if you look at countries like Vietnam or any of these lower income or middle income countries, you're going to see a lot of places where healthcare is localized to cities, like urban areas. And this is a perspective you can get from public health, global health research. But then when you go on the ground, you see there's a lot of lack of access to hepatitis treatment. And so there's a lot of deployment of mobile health clinics. So these mobile medical clinics, MMCs, or mobile health clinics, they bring the healthcare to you as a villager. And so there are a lot of AIDS workers going around in trucks or little cars, and they're going here and there. And there are a lot of UN development partnerships. There are places like the World Bank that cite our research, and they say this is where the aid needs to go. And so when you deploy capital to develop healthcare infrastructure, at the very least, that is an investment into the country's infrastructure, and at the most, it's a public-private partnership with venture capital. So you're getting the marriage of global health and private markets, and you're seeing a lot of very beautiful things come out of that, and not just private markets, but also global government partnerships. And so I've met with a lot of ministers of health and ministers of economics, and we've talked about a lot of those very interesting things. So and certainly even here even in India or even in America, we're seeing a lot of deployment of capital to the most disadvantaged communities through our studies. We're able to pinpoint exactly which populations need it the most.
Right, right. So, in terms of research, what is the type of research you are? You talked about it, but I want specifically now to focus on that. What is the type of research that you are focusing on, which will, again, a common person will understand better? I'll come to that about your, as a venture capitalist, where you have put money in terms of knee rehabilitation devices and all that is understandable. We'll come to that. But in terms of research, I want to understand what are the different type of research that we don't know about that you may be working on, so that people get this hope. Okay, this is going to happen in the future. Some of the things which you would like people to understand or know about.
Yeah. So we're seeing, for instance, a lot of obesity going on, both in America and across the world, and we're seeing that as a result of, I would say, two main things. One, we're seeing a steady rise of sitting down, and especially during the COVID pandemic, a lot of people were sitting down. A lot of people weren't actually traveling, commuting, being active, and so there's also a hint of we need people to get out and about, and we need them both emotionally and physically. It's beneficial for your health. But secondly, and perhaps more importantly, this is a even bigger issue that's still correctable, is the question of diet. And this is something that's going on with these debates now with Wegovy and all these new obesity drugs. My one of my first research collaborators, Dr. Fatima Cody Stanford, is the world expert on obesity, and she's at Harvard Medical School. And she was just speaking to the New York Times about the promise of these anti-obesity medications. So the question of how do we deal with obesity prevalence, prognosis, both in the U.S. and across the world, and how can we adjust our diets so we don't have to just medicate these things away, although it's still helpful. But you're still, even if you have weight loss, you're still not taking in the right nutrients. There are food deserts. There are places all over the world where you can't access fruits and vegetables, or at least a nice, balanced, nutritious diet. So these are larger issues, not just at the level of the healthcare system, which is focused on rehabilitation, but at the level of the government and the Centers for Medicare and Medicaid, which are working on preventative services as well. And we're even seeing this when we're talking about knee research, we're seeing a greater focus placed on the patient rather than on the doctor, which is a new development where we're seeing, for instance, after a knee surgery, um, there's this new rule that came out in July 2024 where orthopedic surgeons have to now understand in the US that what their patients have about their satisfaction scores, called the patient reported outcome measure, is now soon going to be a direct component of reimbursement for those procedures. And that's totally new. So there's also a shift from what's called fee for service to value based care, where we're seeing the actual outcome of a procedure is more important than just having done the procedure and how many procedures you do. And so these are all components of improving healthcare quality, improving preventative, and improving nutrition and access to care.
Right. And you talk about, use of data, turning data into policies that matter. What sort of data? Help us understand about this part.
Absolutely. So, you know, there's turning data into policies that matter, and there's turning data into investments that matter. I'll address both points because I think they're both equally interesting. On the policy side, again, when you're looking at our recent obesity study at the Global Burden of Disease, you're dealing with a lot of questions of which groups need help the most. And this will be helpful if you are a government administrator trying to maximally impact every dollar you spend. Where should it go? And so that's an example of it informing policy. And then in terms of informing investments, well, if we see that people are aging, both in the United States and across the world, and with the population of adults 65 and older growing, and expected to further continue growing in our forecasting studies, we're thinking, well, knee rehabilitation products, where are they going? And so, for instance, Romtech, which is one of the places that I'm invested in, I just did a study on knee osteoarthritis that's coming out soon. It's the largest one in the nation in the history, and we're finding some interesting patterns, and I'll share it later. But it's informing my decisions on where to place investments in orthopedic care. Do you do it in shoulder? Do you do it in weight-bearing joints like knees that degrade over time? So these are all questions that inform policies and investments. They're crucial.
Right. So, do you engage with the government in Washington, D.C., or in any other part of the world the same way, or you deal differently? What is your approach?
Yeah, certainly. It's important to take a culturally sensitive approach to all these things. I will say, I as a U.S. congressional delegate, I do a lot of work in just generally religious freedoms. And so that's just a personal passion project of mine. But I also do work with, I was actually just at the Boston Global Forum where I helped organize an event for President Emmanuel Macron. And in that event, there was the first Minister of Digital Affairs for Taiwan. There were a lot of very interesting people that were all interested in these large healthcare questions. And so when I'm doing work on the global level, there are obviously Americans there, there are Taiwanese there, there are Ghanaians there are people from all walks of life, all areas, because they're all representatives of their own country. And actually, this upcoming February, I have a trip to Cambodia in the works, and I've been working with the embassy there. And we are working on potentially meeting with the prime minister. And it's going to be a very interesting moment for policy and practice there, because I've been doing a lot of studying on Southeast Asia and just Asia in general and their healthcare systems. And so there are a lot of very interesting approaches, and yeah.
Absolutely. Absolutely, Cameron. So, in terms of artificial intelligence, how
Mm.
are you integrating that into your research? Is that the main basis of your research, or your research is focused first on finding what the disease should be focused on, and then you go? Let us understand a bit about how you are using this AI for your research.
Yeah, certainly. Well, when I am trying to work through a really, really difficult problem, at least conceptually, I don't use AI to write, obviously, because that's a surefire way to get yourself kicked out of academia. But I do, I do have some some pieces that I've published on AI in healthcare, AI in the peer review process, which is a process where you for instance, I submitted a piece to a journal, a very famous journal, and they sent it back to me. And I noticed that reviewer one's comments were AI generated. And that sparked off a little conversation between me and my co researcher where we're like, are we living in a post truth economy? Are we living in somewhere where uh, AI can fabricate something and the reviewer doesn't even have time or the incentive to check it over because they're not getting paid for their work? And so these reviewers are doing a service. And so journals can't just overly regulate this activity because the reviewers can just stop doing it and then the journal stops being a journal. So, what's the future of peer review? This is a piece I wrote, a first authored piece at the Mayo Clinic Proceedings. There were other pieces I've written on AI in medical education. What's the future of AI in teaching future global health researchers? And are they going to be cheating in school? What's the value of learning and rote memorization in the world of AI? When you're dealing with all these conditions as a doctor, you have to think on your feet. And so if someone's been chat GPTing their way through everything, they aren't going to be able to connect these very unusual symptoms when someone shows up in clinic. And that could lead to overlooking a lot of conditions, and thus the burden of disease globally for certain things could be overlooked. So there are a lot of very interesting, the tendrils of AI go everywhere, and I'm happy to talk about any of these avenues.
Right, right. Let's talk about, investing as a venture
Mm.
capitalist. So, how do you do that in terms of investing in startups? What's the way one should go about if they want to invest in startups, especially with regards to medical devices or related to medical line itself? How do you do? You are very young, but you seem to know quite a bit about these things. So, guide a lot of youngsters who might be looking at this particular line for investing.
Mm. Yeah. First thing I would say is venture capitalists love expertise. And the reason they do that is because when the economy is good, they will just pick anyone up with an MBA and they'll say, okay, go invest in healthcare. Because there are just so many opportunities. The positive predictive value of an investment is higher if a greater proportion of the investments become successful just mathematically during a good economy, during a bull run, right? But when money gets harder to find, venture capitalists seek talent, and not just talent, they seek positionality. And what I mean by positionality is they're looking for people with PhDs, with MDs, the heavy hitters in the field. And here I'm just talking about healthcare. I mean, this same concept applies to software engineering, where they're looking for Google software engineers and people from FANG companies. But at least in healthcare, if you just have an MBA, you're good, but you don't understand the specific issues that a clinician faces. And I'll give you an example. There was a recent company that I was asked to evaluate, and they were asking, they had asked a room full of MBAs about this new balloon that you'd put down your throat and it would expand in your stomach so you could do uh, place a GI tube and just place it into the stomach versus just doing an ultrasound guided procedure. And none of the MBAs knew if this was a good idea, if this was even something that clinicians were having trouble with. They just saw this ragtag group of like 20-year-old entrepreneurs who just developed a balloon. And who knows, it might be the next huge company. It might also flop and be a total failure. And especially in healthcare, where you're committing capital and there's a lot of red tape regulatory wise, and you'd have to go through multiple rounds of studies. If you're an entrepreneur, if you're an investor, you should be able to call out fake stuff very quickly. Otherwise, you get an Elizabeth Holmes Theranos type situation where they're kind of cheating you out of your money. There's a lot of fraud that happens in venture capital. And it's important to know that. And it's important to have the wherewithal and more specifically, the specialty specific knowledge to be able to call that out and not deploy your capital there.
Absolutely, absolutely. So I want to understand. You are very young. You are doing a lot of things. A lot of young people uh, have their own way of looking at the world. You must be having your own way of looking at the world. You are the future of the world. If I look at it from that point of view, when you hear and you have invested in knee replacement devices, rehabilitation devices in that sort of a company, when you listen or talk about or get to learn about all these reports about how some doctors, some hospitals push these devices even when it is not needed,
Mm.
not just in knee but in many other areas of the human body, how do you feel about, if you are an investor in such a company, you would be benefiting it, but as a youngster who is also the future of the world, at least from my point of view I see it, how do you think it about it sometimes? Does it impact you in any manner?
Yeah, and I'll tell you, this is why I'm going into medical school. I came out of UPenn, and at UPenn we have this business school called Wharton, and a lot of people there who graduate from UPenn, typically they start out as pre-meds. They're the typical, I'm an Ivy League student. I want to go to medical school. I want to, impress my parents. And then they see how much money they can make in business. And so they tack their majors into healthcare finance, into healthcare management. But the thing you lose by doing that is the clinical perspective. Now, I'll give you an example. Private equity firms, when they enter, hospital space, they might have these what we call empty suits, and so they go into the hospital and they say, we don't know anything about the healthcare, how it works on the wards, but we are going to just cut um, long-term care for patients, and we're just going to have short-term, or rehabilitation, or community partnerships for preventative services. We're going to cut those because it's wasted money. Like, we should be spending money on procedures, specifically orthopedics. What happens is, during the pandemic, for instance, pediatrics departments don't make a lot more money than orthopedics departments. They make very little. In fact, they're a cost center almost for the hospital. So what a lot of these private equity owned places, or at least just corporate, hospitals did, is and nonprofit hospitals aren't immune either. I mean, they're nonprofit for tax purposes. They still make profits for the higher ups. So what they did is they cut their pediatric services. And what happened? Well, after the COVID pandemic, a lot of children got respiratory syncytial virus, right? And where do they go? What is the what happens? I mean, at the least, that's a supply demand mismatch. At the most, that's just a terrible situation for our nation's kids. So if you don't have the on the ground experience of what it means to have a longitudinal relationship with your community as a hospital, both from the investor side and the clinician side, you're going to destroy relations with your community by cutting essential services. And that erodes medical trust in the hospital systems. And that's just bad for you as an investor. So as a healthcare investor, you have to bring a balance of both. Otherwise, you'll get neither. And that's one lesson I would give to a lot of healthcare entrepreneurs is you need the clinical side. It's not just a good thing to have.
Right. And so, looking at the future, how do you envision yourself in terms of this whole healthcare thing, how it should ideally be? Do you have any ideas? Do you sometimes think those are utopian ideas? It will not be like that, but maybe some practical ideas that you think, okay, this is what is possible. This is what I will aim to do. You know, even if you are investing in any of the healthcare companies.
Yeah, yeah. There's always something going on in healthcare. That's something that I just absolutely love about the field. It's not a slow field. Uh, there are a lot of regulations that we have to cut through. One thing I'm very excited about, obviously, is AI. So with AI, you're going to have faster diagnoses, more accurate things occurring, sometimes even surgeries. As a medical student, even I've gotten to see a lot of orthopedic surgeries and scrub in, where they're using robots to help replace the knee. And something that's very exciting in orthopedics is that when you replace the knee, you typically have to shave off the existing knee and then place a metal cap. That's a medical device that people invest in. And they fight over, their turf wars. Like, oh, this orthopedic surgeon uses this implant, this one uses a different one. That's fine. But when they place it in, traditionally, when you shave it, you can't actually see anything because there are bone shavings covering that bone, and so you have to keep wiping it away, and it's a messy process, and you have to then implant the metal device, the head, onto the knee so it can articulate with the joint. But what happens with these new, it's called the Mako robot, and so it comes out, and it's a computer-assisted device that works with your medical imaging that's placed on a flat screen TV. And what it does is geometrically carves it in 3 different areas so that the medical device fits absolutely perfectly onto the knee. And this can reduce a lot of implant issues that can occur later on. Of course, a lot of these orthopedic surgeries are extremely well tolerated, among the most successful surgeries in medicine. In fact, with a hip replacement, you could be out on the street walking like 3 hours after your procedure. It's ridiculous. These are life-changing procedures. So just the fact that they're developing at such a rapid pace, and not just this, but in India. My colleague was in India this summer filming a documentary on spine surgery. And he saw this neurosurgeon working on spine surgery, and the machine was just placing screws by itself. This is something that doesn't even happen in America because America is so heavily regulated. But in India, there are a lot of exciting innovations coming out, not just in orthopedic surgery, but in neurosurgery and in the combination of the two, the spine surgery. And then we'll see the impact even more on internal medicine fields, cardiology, when to spot emergencies. Just having someone constantly monitor you, that person has a lot of other patients to see. If a robot's monitoring you all the time, you get a better quality of care.
Absolutely, absolutely. There is much to learn from you about all these things, Cameron, and I'm sure in the going days, a lot of the world will also learn a lot from you as you progress further in life, either in investing, either in medicine, or either in your research. So, a lot of people who would like to connect with you, know more about you, more, follow you for whatever you are doing, and then perhaps also invest with you along with you. So, what is the best way for them to connect with you?
Yeah, please follow me on LinkedIn. I'm just my name, Cameron Sabet, at Georgetown Medical Center, and also maybe on Instagram, Cameron Sabet, again, just a word, and on Twitter. I think that's also Cameron Sabet. I can check. Um, yeah, it's just at Cameron Sabet. So lots of different ways to connect, and you can shoot me a message, and we can talk further.
Wonderful. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.
Thank you very much. I really appreciate you having me today. Thank you.